Today, we are going to interview someone from Nigeria who has used the D178 and IDOC to treat his wife's aunt. And this condition is known as multiple myeloma. For those of you who are not fully aware of what multiple myeloma is, this is from mayoclinic.org. Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Healthy plasma cells help fight infections by making proteins called antibodies. Antibodies find and attack germs. In multiple myeloma, cancerous plasma cells build up in bone marrow.
My name is Chamberlain Owen from Nigeria, and I'm using the D178 and the IDOC 1 hour each with my aunt, my wife's aunt, who has multiple myeloma, and yes, we've been at it. This is our 8th day, and we've seen improvements. When I came, I mean, she was really very weak. She could barely talk. The daughter is also here, so maybe I might ask her to come and make some contributions as well. So,
So, how long has she been diagnosed with multiple myeloma?
6 weeks. 6 weeks now.
Okay, so she's
6 weeks.
been diagnosed.
They caught the problem late. Yeah, she's been complaining of pain for a very long time.
Okay.
So they've just been treating until it just got terrible. And then when they did the blood work, discovered that it was something worse than what she was complaining about,
Okay. So so before that she had all the symptoms and she was complaining, but they didn't do a proper diagnostic.
Yes. They didn't.
Yeah. So now how long has she been using D178 and IDOC?
And she's been using D178 and IDOC for 8 days. Today is, I think, day 8 right now.
Okay.
And she only do once a day, each one, because I can only come here once,
Okay. How long?
1 hour each.
1 hour each. And the IDOC is the ear clips?
Yes, the ear clips, the vagus nerve.
Okay.
We've not been able to do the stimulation on the left hand, for the electroacupuncture, because she has a fracture on the left hand. Right. And, but that first day we started using the IDOC and the D178. The following day when I came, she said she slept well, and her pain had reduced
after the first session.
Yes.
That's great.
Yes. So then when I did the second treatment, so she now complained about her breathing, that she was breathing through the mouth. The first day I only did the D178, not the IDOC. So I told, when she complained about it, I said, "Oh, don't worry, I have the IDOC with me." So I connected the vagus nerve stimulator, and just after about 40 minutes on it, as she was, I started again, close to 45 minutes or so, her breathing came back to normal. She said, she now told me, I breathe much better now. And before she was breathing through the mouth, now she can breathe normally. So we used that, and as the days went by, her voice started getting stronger, and being able to have conversation. Her appetite did improve over what it was before. She was able to finish her food because she was barely eating, and and she was on a chemo drug. So the chemo drug she was on, she's 72 years old. So ended on Friday, I think. Was it on Friday?
Saturday.
Saturday. And so it ended on Saturday. She's supposed to restart another set of chemo drug in 2 weeks or so. But then again, there's the case of the surgery that they're considering, but because of the lesions. So hopefully a doctor is going to look at it on Friday to see if she's viable for, the bones are viable for surgery, you know, because of lesions around caused by the multiple myeloma. But I'm hoping that the eye doc would have improved, or the D178 as well would have improved the status of the lesions once they do the x-ray to look at it. So I am here at least every day for 2 hours doing one of each. That's the most we can do for now. With what is happening with my aunt, my wife's aunt, it's been wonderful. You can hear the noise in the background. They are friends.
Mm-hmm.
They were having conversation earlier when I came. They were, and she was in the conversation lively. She was sitting up. Now she's taking the vagus nerve stimulation. So, and you know, I was very pleased. Her voice is stronger, you know, like she is healthier. And maybe, Saludo, do you want to say anything?
Okay, yeah.
Yeah, maybe you can come. Maybe the doctor can come and sit down and talk.
That's great.
Let it not look like I'm just, yeah, this is the doctor.
Hi,
Hi, how are you?
I'm fine, thank you. Good day.
Yeah, so it's good to see your mom feeling better, and I'm sure
She
you
is.
must be very
She's feeling better.
yeah, especially
Yeah, like her energy level has really come up in the last week. And like you said, her voice is stronger, her appetite is better. So I actually see the improvements in her. So thank you for this device.
wow. And it's only been very few sessions, a week of
A week, actually, yeah, about a week. We didn't do 1 day. So let's say 7 days.
7
Wow.
days, and
And it's once a day.
once a day for
once a
each.
day, 1 hour of each. Yeah, it's amazing.
Yeah.
Well,
Yeah, it's really cool. It's really cool.
yeah. Well, continue to use it and inform us about the progress. And I'm very excited as well.
So,
All the best to your mother.
sure.
Much.
Thank you. Really appreciate it. Thank you. Take care.
Okay.
Okay.
Okay.